All righty. Well, good afternoon, everyone. My name is Tyler Ferrari. I am a management analyst here with the City of Canyon Lake. I wanted to thank you all for coming today. It looks like we have 5 people in so far. Um, so if you know anyone that is looking to join and they've registered, let them know that we're going to get started right now. Just want to take some housekeeping things off the table before we get started. If you do have any questions anytime during the town hall, please utilize the chat or the Q&A function down at the bottom of your screen. We'll be happy to answer any questions that you all have. In addition to that, those who did ask questions beforehand on the registration form, we're going to be getting to those questions once Chris here is done going over the program, and then we'll be taking any live questions that you all may have. If you prefer to ask your question over voice chat, feel free to just raise your hand or put that in the chat, and we will be able to take your question that way as well. So without further ado, let's get started. Chris, whenever you're ready.
Okay, well, good afternoon, everybody. Thank you so much for joining. This is our first ever virtual town hall meeting. We think we've got all the kinks worked out, but let us know if you're having trouble hearing or communicating. At the bottom of the screen, there's a raise hand button. So if at any point you have an extra question or need clarification or need help with something, just raise your hand and we'll do our best to keep a lookout for that. But I appreciate your time joining us today to talk about the EMS subscription program, which is a program that's going to be incredibly important for the city moving forward for our ability to continue providing EMS services in the community. Last fall, when the City Council was discussing and adopting Ordinance 187, which is the EMS subscription program, we made it pretty clear that before the fees themselves were adopted, we would conduct community meetings to talk about it. Well, since then, the world has changed, and we have not been able to conduct in-person community meetings. So we thought, let's do this virtually. Let's do a virtual town hall. So with that, I'd like to go into some of the background on how we got to where we are today, give you a pretty in-depth history of how we got here. I'm going to turn my camera off for a bit while I go through this because I'm just going to be reading off my notes. But then when we start up the discussion, I'll put the camera back on. So as you probably know, the city provides fire and emergency medical services, or EMS, through a contract with the County of Riverside. The county, in turn, has a contract with CAL FIRE to serve as the county's fire department. So, in essence, the city contracts with the county, which provides CAL FIRE personnel to perform fire and EMS functions in the city of Canyon Lake. I want to clarify right up front that we are not talking about ambulance services here. That's another service entirely. Ambulance service in Canyon Lake is provided by AMR through a contract AMR has with the County of Riverside. So AMR's role is to provide medical transportation. AMR is not designated as a first responder in Riverside County. Emergency medical services are provided by the fire department, and then AMR will transport to the hospital if necessary. So AMR bills separately for the services, and again, that has nothing to do with the city. What we're talking about today are the emergency medical services provided by the fire department, which the city pays for through our contract with the county/CAL FIRE. So now that that's clear, the arrangement by which the city contracts with the county for fire and EMS worked pretty well for the city for many years. The primary funding source for public safety services is property tax revenue. In fact, the city receives revenue from what is known as the fire structure fee, which is really a portion of property tax revenue that the county collects and sends to the city for fire suppression efforts. This amounts to about $1 million or so per year to the city. I think next fiscal year, we're projecting approximately $1.1 million. And for many years, this was sufficient to cover the city's costs of providing fire and EMS. However, over the years, the county began charging the city more and more for fire and EMS. Eventually, the costs handed down by the county far exceeded the revenue that the city was receiving for providing the service. and the city's budget was thrown into a structural deficit. The city looked for ways to cut costs, but found there were very few options. In 2014, Canyon Lake voters approved the establishment of a utility users tax. The UUT is a 3.95% tax on utility bills. Now, the UUT has been a tremendous help and was renewed by voters in 2018, but the rate remained at 3.95%. The UT, which initially generated about $800,000 per year in revenue, today brings in about $1 million a year. Although in recent years, UT revenue has begun to decline as more and more residents are installing solar panels, cutting the cord on cable TV, and employing water conservation techniques. Despite the revenue brought in by the UUT, public safety costs have continued to rise steeply over the years. But the straw that broke the camel's back came in 2012 when the county established as a county-wide standard a minimum staffing level of at least 3 firefighters on every engine. Canyon Lake had historically run 2 firefighters on engine at Station 60. So this requirement alone increased the city's cost by over $700,000 per year. Now, the city fought the county. The city objected to the increased staffing, which it did not see as necessary and simply could not afford. The city, feeling backed into a corner, stopped paying the county's invoices. Lawsuits were filed in both directions, and Fire Station 60 was ultimately closed from July 2015 to July 2017. Eventually, facing tremendous public pressure, the city at the time relented and agreed to reopen the station under an agreement with the county that would allow Station 60 to operate with 2 firefighters for a period of 1 year, and then adjust up to the countywide standards of 3 firefighters on the engine. So in July of 2018, the city's budget began feeling the full brunt of county-imposed budget and staffing increases. And since that time, costs have only continued to rise. Since the year the UT was adopted, the costs of providing fire and emergency medical services have increased 79%. In fiscal year 2014-2015, the budgeted amount for these services was $1,263,000. This fiscal year, that has gone up to $2,259,000. That's an increase of $996,000 in just 5 years. And keep in mind that those costs are for manning the same single engine at the same single fire station. And that's just for fire. The amount the county charges the city for the services of the sheriff's department have increased by more than 41% over the past 6 years. We're paying over $500,000 a year more today than we were 6 years ago for the same level of service with the sheriff's department. Now, the city runs a lean operation. Our entire general fund budget is just $5.8 million. $4.2 million of that, and rising, is for public safety. So the city spends just $1.6 million on everything else it does other than public safety. Public safety costs are out of control, and they're out of the city's control. The city has been evaluating its options. Those options may include forming our own fire department, joining with other cities to form a fire department under a joint powers authority, contracting with another entity instead of the county of Riverside. And those options are continuously being evaluated. But in the meantime, we must be able to continue providing quality emergency services. And that's where the EMS subscription program comes in. When a city incorporates, that is when residents of an area decide to become a city, there are certain services the new city legally must provide for its residents. Police, fire, building and safety, land use planning, etc. Interestingly, emergency medical services are not on that list. Cities are not legally required to provide EMS. Now, most cities do because its residents expect the service and because most cities take the health and safety of their residents very seriously. However, as in most areas, emergency medical services have become much more expensive in Riverside County. What's more, EMS calls now account for the vast majority of 911 calls to the fire department. In Canyon Lake, over 80% of calls the fire department responds to are for EMS. Unfortunately, we simply cannot continue to provide this service without additional revenue. And so, like many other cities in California have done, in November of last year, the Canyon Lake City Council voted to establish an EMS subscription program. In order to continue providing adequate emergency medical services, it became necessary for the city to charge a per call user fee when these services are requested. The proposed amount of the fee, which the council will discuss and vote on next week, is $1,483 per call, which represents the actual cost of providing EMS services. Now, the City Council resolution, which establishes the user fee for emergency medical services provided by the fire department, also establishes a subscription fee as an option for Canyon Lake residents and businesses as a way to protect themselves from unexpected out of pocket expenses. By subscribing for only $16 a month, everyone in the household can be covered without having to worry about receiving a bill should services be needed. To encourage participation and to make it as easy as possible for residents to participate, Canyon Lake residents will automatically be registered, and the subscription fee will be collected through property tax bills, just as our trash fees are. That being said, the subscription fee is completely voluntary. Anyone who does not wish to participate may opt out by sending the city clerk notice prior to June 3rd. However, if you opt out, but then end up utilizing the emergency medical services, you will receive an invoice in the amount of $1,483 each time the fire department responds to you. So we do strongly encourage everyone to participate in the program. Not only does it serve as an inexpensive insurance policy for you and your entire household, but you'll be doing your part to preserve the city's ability to provide quality public safety services. So that's a basic background of the program and why it's necessary and how we got to where we are today. And with that, I'd like to open it up for questions and discussions. And I think we're going to start, Tyler, with questions we received prior to the start of the town hall.
Yeah, exactly. So if anyone has any questions from what Chris just said here, again, feel free to utilize the chat or the Q&A boxes at the bottom of your screen. The first question that we have comes from Elise. It doesn't look like Elise is on the is in our town hall today, but she did ask, how does this affect me if I opt out? I have medical insurance that covers emergency services, so why do I need this type of program?
Well, Elise, thank you. And it's a good opportunity, since Elise isn't with us, to point out that we are recording this, and we will make it available on our city Facebook page. So hopefully that'll be up by the end of the day, and anyone who wishes to review it or who wasn't able to join and wants to watch can do so there. But to answer Elise's question, first of all, I want to make clear that regardless of whether someone is subscribed or if they opt out, everyone will continue to receive the same level of service that they were before. If you call 911 and you need the service, you will receive the service regardless. But I do think it's important for people to subscribe. People who have good health insurance, some of those insurance policies may cover the emergency medical services we're talking about. But remember, we're not talking about ambulance service. That's a separate thing. Most health insurances do cover all or a portion of the ambulance cost. Fewer insurances, but some do, provide all or a portion of EMS costs. So if you suspect that your insurance covers it, you may want to check your policy, with your health insurance company, and find out if the EMS services provided by the fire department would be covered. Tyler?
It looks like our next question here is from William Everly, and it's not quite a question, it's a comment. He wants people to understand how this ensures the availability of services. So maybe, Chris, if you can go over that just one more time.
Yeah, so as I touched on in the background of how we got to where we are today, the city has struggled with skyrocketing public safety costs for really over a decade. And that led a few years back to Station 60 closing for a couple of years. So we have to find a way to have sustainable revenue to provide these services. Now more than ever in a time of crisis, we have to be able to provide quality EMS services. Because of the spike in costs, the city is currently running a budget deficit of approximately $800,000 a year, a little over $800,000 a year. So we've been working very hard, the council and staff, over the last year and a half, to find solutions to fix that structural deficit so that the city can continue providing those important services.
All righty. The next question we have is from Deb Jensen, who I see is on the call here. and she is asking, what exactly does it cover?
What exactly does it cover? So again, the subscription covers EMS services provided by the fire department. So if you call 911 and you have a medical emergency, could be a heart attack, could be falling downstairs, and whatever it is, the fire engine will respond to that emergency with a paramedic on the engine. Um, in Riverside County, AMR is not designated as a first responder. So really the AMR ambulance is for transport to the hospital. The fire department is the designated first responder. So the fire department responds with the paramedic. They provide medical services, get you stable. And then if you need to be transported to the hospital, AMR takes it from there. So the EMS subscription covers you and everyone in your household for those EMS services.
Alrighty, great. And it looks like that Bert is here in the call, and he had too many questions to list. So if he has any questions, Bert, you're more than welcome to ask. We're going to go on our first set of questions here in the Q&A tab, and Richard asks, what has been the recent inflation rate of EMS services per call?
I'm not sure that I understand the question. The inflation rate of EMS service per call. Maybe I could ask Richard if he could clarify what he means by the inflation rate of EMS service. And
Okay.
in the meantime, while
And
he's
he also did ask what the anticipated annual inflation rate for the services are.
I see. Okay. So I think the question, if I understand it correctly, is can people expect that the subscription fee will increase over time? And if so, by how much? So, by law, when a city is establishing a fee, an analysis has to be done to determine the actual cost of providing the fee, because a city cannot legally charge more in a fee than it actually costs to provide that service. And so we do anticipate bringing these fees back to the council on an annual basis, and they should adjust either up or down depending on what the actual cost of providing the service is. Our experience in recent years is that cost has gone up pretty consistently. However, the city is actively looking for other solutions to provide public safety. So, one example is that the city has a firm currently working on a feasibility study for starting our own fire department. So if one of these alternatives ends up becoming viable and the city is able to make a change in how we provide that service, those costs really could come down significantly. And when our costs come down, the subscription fee would have to come down as well. So the cost will adjust probably annually, but it will all be the actual cost the city is experiencing for providing service.
Alrighty. Deb asked another question here in the chat. She stated that everyone in her household is covered. Exactly what does that mean? If my mother has to come live with me, will she be covered?
So the way the ordinance is written is that it covers every permanent residence of the household. It does not cover visitors or guests. So if a relative like a mother is coming and they are living with you, then at that point they are considered a permanent resident of that house. If they're just visiting for the weekend or for the night, then they're just a guest, and that would not be covered. But as someone living in the house as a permanent resident, yes, they would be covered.
All right, we have a next question here from Laura. What percentage of homeowners have to join in order to balance the EMS costs?
Well, we really want to encourage everyone to join, not just because we think it's a benefit for residents, but also it just stabilizes the program and reduces the city's costs of providing the service, because everyone who receives the service who is not subscribed will have to be invoiced. And with that invoicing procedure, there come costs for the city. So the lower the city's costs are, then the lower the program costs for everybody. However, the program is designed in a way that even if nobody subscribed, even if 100% of the residents opted out, the service fee that's charged when a fire engine and paramedic roll out to a scene, that service fee should also cover the cost of providing the service. So whether someone is subscribed or whether they're not, either way, the cost should be covered.
Alrighty. It looks like as of right now, we don't have any more questions. So again, if anyone has any questions regarding the EMS subscription program, you're more than welcome to ask them now. You can utilize the Q&A function as well as the chat function, and I'll read out your question to Chris, and Chris will be more than happy to answer it for you.
I'm seeing a message here from Deb. It indicates maybe I didn't answer the question. I just want to make sure, Deb, that if I haven't, that you let me know so I can clarify anything that needs clarifying.
Yeah, she asked two
Oh, I
questions.
did now. Okay, great. All right. Thank you, Deb. Thank you.
All right, looks like we have another question here, or two more questions. It looks like from Richard. What is the time frame for subscribing / opting out?
Okay, so the time frame is established in the ordinance, and currently residents have until the city council meeting when the fees are adopted, which is June 3rd, to submit a notice to the city clerk opting out. And it will continue to be that way every year. There'll be a period starting, I believe it's in May at some point, running through the council meeting in June for people to opt out. And the reason we have to have a drop dead date is since we're collecting this through the property tax roll, we have a pretty strict timeline of when we have to submit the list to the county for collection. But the answer is June 3rd.
Okay, and Laura has another question. Is this soft billing or hard?
I'm not sure that I know the difference between soft billing and hard, but I can tell you what the billing process will be. The city currently has a contract with a company called Data Ticket, and Data Ticket historically has worked with the city's code enforcement department. So when the code enforcement department issues a citation, that citation is sent to Data Ticket, and Data Ticket sends the invoice to the resident, and if necessary, initiates collections, and also provides an appeals process and an appeals hearing process. So the vendor takes care of all that on the part of the city, which is great because we have a very small staff here in the city of Canyon Lake. So we have entered into a contract with that same company, Data Ticket, to handle the invoicing for the EMS subscription program. So every month we'll receive from the county / CAL FIRE a list of the medical calls that they've responded to. We will check that list against our list of those who have opted out, and we'll send the list of people who received calls and who are opted out to Data Ticket to send invoices every month.
All right, it looks like Laura sent a clarification. She says that soft billing means that if you don't pay after a number of requests from the city, they will not pursue it any further.
My understanding with Data Ticket is that there is a collections process that they go through. And if they are unsuccessful, then at that point, it is placed on the as a lien on the property.
All righty. Laura's next question here is, what is the projected cost for starting our own fire service?
So we are currently working with a consultant, ESCI, who's a big name in the industry, very well respected, to do a very thorough feasibility study of starting our own fire department. We expect to have those results by July at the latest, hopefully even in June, and we'll be bringing that to the council to discuss. We don't have those exact numbers yet. I can tell you, we have some numbers in our head that are where we'd like to be. We think if we can get it done for anywhere under $1.6, $1.8 million a year, then we'll be in good shape, which is a lot better than the 2.2, 2.3 million and rising every year that we're experiencing with the county right now.
All right. Bert has a question here. Have any other cities implemented this?
Yes, definitely. These programs are becoming more and more popular. There are a number of cities in Riverside County that have had these programs. It's incredibly popular in Orange County, but in Riverside County, the city of Norco has a very similar program. The city of Corona has a similar program. In Orange County, Fullerton, quite a few cities in Orange County have it. cities in Los Angeles County as well. So we looked at a lot of those other programs when we were thinking about putting together something for Canyon Lake, and we patterned ours after what we saw in other cities.
All right, Bert's next question is how much will a guest be charged?
So anyone who is not subscribed in the program, which at this point guests are not eligible to subscribe, will be charged the service fee, which is the 1483.
Alrighty, it looks like Deb has another question here. Who owns the land and the building where the fire station is?
So the land and the building are owned by the POA. The POA leases the fire station building to the city for $1 a year.
Alrighty, that looks like it clears out all the questions we have so far. If anyone has any other questions. Oh, all right. Bert just sent one in here. Why is this a fee and not a tax?
That's a great question, Bert. Thank you. The primary answer is that it's optional. So it's the fee for service is the service fee. It's the 1483 if you use the service. You only get charged the fee if you use the service. So it is a true fee for service. The subscription amount, which is the $16 a month, that is completely optional. If people don't want to be part of that program, they have every opportunity to opt out, which by definition makes it not a tax.
All right. With that question, it looks like it clears out the queue that we had here. If anyone has any other questions, feel free to send them in. In the meantime, Chris, is there anything you want to add?
No, just that I really appreciate everyone who's participating today. This is an incredibly important program for the city. It's one of the biggest programs the city's ever started, and we see this really as the primary way that we can get out of this budget deficit situation that we've been in and continue providing very important services for the residents.
All right. Laura sent in a question again. Where can we get a copy of the ESCI study and the budget for the program?
Sure. So the ESCI study, again, is the feasibility study on potentially starting our own fire department and examining some other alternatives for providing fire services for the residents. So that's the study that's still in the works. We should have that again June or July. I'm hoping for June. But that will be coming to a city council meeting for review. It will be made publicly available at that time, and we'll be happy to make that available to anyone who would like to see it. I'm sorry, what was the second part of that question?
So she asked where will be the copy of the study and the budget for the program?
The budget for the program. Well, let's see. We do have a fee analysis that had to be done as part of the EMS subscription program, which outlines how we got to determining what is cost recovery, what's the actual cost of providing the service. So that fee analysis will be available to anyone who wishes to see it at City Hall, beginning after the City Council meeting on June 3rd. So if anyone wishes to see that study, after the June 3rd meeting, all they have to do is contact the city and we can provide that.
Richard has a question here. Is the subscribe/opt-out decision binding for the entire year, or are there mid-year opportunities to change?
Yeah, that's a great question. So because we have to submit to the county for the tax roll, we only have the opportunity to do that once a year. So once you've opted out, that decision is more or less final for the rest of the year. However, with the caveat that if someone has opted out and they change their mind, or let's say somebody moves into town mid-year and they want to join, they can come to City Hall. There's a registration, there's an enrollment form. You can just pay the fee up front. You can write a check or credit card, however you want to do it, and then you'll be added to the list. So I guess the answer is, we submit to the county once a year, but if you want to join in mid-year, you can do that. There's really no way to opt out mid-year though, because we've already submitted that to the county and they're already assessing that on the tax rolls.
All right, let me check both boxes here. Laura has a question here. How will these fees be collected? Will they be dues or will they be on the property tax bill?
So the EMS service fee, which is, if you are not subscribed, if you've opted out and you use the service, that will be an invoice that you will be sent from our consultant data ticket. And on the subscription side, the subscription, which comes to $16 a month or $192 a year, that will be assessed on the property tax rolls, just like we do with our trash fees here in Canyon Lake. So you'll see that divided, in your two property tax installments. So the first time you'd see that would be this November.
All right. Currently, no questions in at the moment, but we're getting some really great questions from everyone today. So if anyone has any more, feel free to ask. We're more than happy to answer as many questions as you all have.
I see a question from Deb here. She's asking, how will new homeowners be made aware of these services if the previous owner opted out? And that's a good question too. So every year the city will be sending out a notice explaining the program and letting people know that they will be automatically enrolled unless they opt out, and explaining the opt-out process. So we know going into this that we're going to have to send that notice every year, and so that's how new residents will learn about it. We haven't really developed a way to inform new residents kind of in real time. So if someone moves in November, they probably won't hear about this until April when we send out the notice, but they will get noticed.
So it looks like she asked asked a follow-up. So it's our responsibility to inform the realtor, basically.
To inform the realtor. Yeah, I'm not completely clear on the question there.
I think what she's asking is, say if you were to sell your home and you opted out, you would have to tell you it's on the seller to
I see.
that you opted out.
No, so the county keeps all of those records. So when someone sells their home, the county updates their records to show the new owner, and the city will get our list every year from the county, so it will automatically be updated.
All right, she said, got it. So any other questions from any of our other attendees here?
Let me touch on one other thing that that has been a common question that's come up that I think is worth explaining, and that is in situations where you have a landlord and a tenant, where the landlord lives somewhere else, not at the property, and then you have a tenant. The tenants are covered. Both the landlord and the tenant would be covered at the property site. So it's whoever's in control of the property and whoever the permanent residents are covered. Now, the landlord is the one who is automatically charged on the tax roll unless they opt out. So as long as the landlord doesn't opt out, a tenant is covered. If a landlord decides to opt out, a tenant can still be covered, but they have to sign up themselves. They have to come in and pay the fee, the annual fee, and then they'll be covered. So that's one thing that we're still working on, figuring out a way to communicate that to tenants. So we encourage tenants to check with your landlords to find out if they have opted out or not. And if they have opted out, and if you want to participate, then you just have to come down to City Hall and fill out an enrollment form.
All righty, Laura has a question here. What are the projected revenues from this program?
So that's a really good question. We feel that this program will go a long way to kind of fill that budget gap for providing EMS services. When you back out the dedicated revenue stream that is the fire structure fee, which is again that portion of the property tax, and when you get rid of all the calls that are not EMS, which are less than 20% of the calls, the city's general fund burden for EMS is about $940,000 a year. We think that we'll get somewhere between $700,000 to $800,000 of that back through the EMS service. So it really won't be a complete cost recovery, but we'll get a lot closer, and it should help us a lot.
Laura is also asking on our next question here, is there a sunset clause?
There's not a sunset clause. Again, remember, this isn't a tax. It's a fee for service. So There's no sunset clause built in. That being said, it is established by ordinance of the city council. So the city council can change it at any time.
Alrighty, clearing out here. Looks like all the other questions have been answered already. Our queue's open if anyone has any other questions.
Okay, so again, I want to thank you all so much for participating. The fee will be decided at the city council meeting next week, Wednesday night. Meeting starts at 6:30. Comments can be submitted via email since we're still, because of COVID-19, not open to the public. But if you have questions, feel free to email media at cityofcanyonlake.com, and we'll be happy to get them answered. If you want to submit public comment for the city council meeting, you can do that at public comment at cityofcanyonlake.com. And I want to really thank you for your time.
Alrighty, thank you all so much for attending. I placed the email for any questions y'all may have in the chat box there. So if y'all have any questions, again, email media at cityofcanyonlake.com. Thank you all. Have a great day.